Hello, my name is Patrick Usher, and in this video I wish to discuss the three main ways that the heart rate will come down when you are recovering from POTS. There are three main active ingredients of recovery that lead to a normalisation of the supine to standing heart rate differential. Now, I'm just going to give a caveat that these are my views as someone who has thought quite a lot about POTS, but who's nevertheless not a medical researcher or professional, but just someone who had the condition and who recovered by following the dynamic neural retraining system, a limbic system rehabilitation program, and then tried to work out why that had worked for me. So these are thoughts that stem from the theory I'm trying to put forward as to the cause of POTS and what I believe to be its most effective treatment. So that's just a caveat. I could be wrong, as with anything, and I'm not at all tied to any points I make if scientific investigation ever shows them to be misplaced. So anyway, the three main ways that heart rate will come down when you are recovering from POTS. And this is important because I think, especially in the early stages of recovery, when you have POTS, and you're using the dynamic neural retraining system to recover, you may be sort of anxious that your heart rate from supine to standing isn't coming down as much as you'd like in the first few months. And there are reasons for that, I believe, because I think there are three key factors that lead to the reduction of heart rate, and they can only occur at certain points and when certain things have happened. These three factors cannot happen overnight. It's impossible. So it takes time. So I'm going to speak of those three things. So let's say, for example, you have someone who, when they start doing their brain rewiring program, their supine to standing heart rate increases by, let's say, 60 beats per minute, so rather extreme end of the POTS continuum. So when they're lying down, it's 80, and when they stand up, it's 140, for example. Okay. The first thing that will cause that heart rate to go down, both overall resting but also the supine to standing, is once the signal from the limbic system, which is stuck in a traumatized state in POTS, once the signal from the limbic system to the adrenal glands to release adrenaline all the time is switched off. That's the first step, because those who have POTS, certainly it was in my case and in the case of everyone I've read about online or discussed this with in correspondence, they all have a constant release of adrenaline. In my case, it was about every 7 or 8 seconds. That seems to be the case across the board. Sometimes it's more intense than others, but it is usually happening. Constant and persistent release of adrenaline, which is, of course, a sign that the flight or fight part of the brain is stuck in trauma. So the first thing that will happen when you follow the dynamic neural retraining system, the first sign of progress is that this constant signal for the release of adrenaline to occur will cease. That's not to say that you may not still have the release of adrenaline from time to time, or indeed in the early stages of rewiring that it may come back for a period and then be switched off again. But the key thing is that more and more of the time that is switched off, and eventually it is only released appropriately when you are actually in danger. So eventually that stops. Now, of course, adrenaline, when it soars into the bloodstream, it eventually, or pretty soon actually, makes contact with the heart. And when it makes contact with the heart, it causes the heart to beat faster. Okay? Adrenaline is the flight or fight hormone, and the heart must beat faster when adrenaline reaches the heart. Okay? Similarly, the very signal of crisis from the limbic system to the autonomic nervous system, in and of itself, also causes the heart to beat faster. So there are two very immediate reasons why in POTS the heart is beating faster. Now, once you get out of chronic flight or fight mode, that aspect of heart rate increase will stop. Right? So you won't have the adrenaline reaching the heart all the time anymore. You won't have the direct crisis signal to the autonomic nervous system causing increase in heart rate anymore, or at least not all the time, right? So all of a sudden your heart rate will come down considerably. Now, of course, no studies have been done on this, so it's very hard to say by how many beats per minute that will lead to a decrease, how many beats per minute. So this is supposition, but let's say 15 to 20 beats. So whereas before, someone might have been increasing by 60 beats per minute upon standing, suddenly it's 40 or 45. And their overall heart rate increase, in general terms, also lying down, which is also increased in POTS actually, comes down. So that's the first factor, and that can happen relatively soon. The second factor takes much more time, but I believe that it is guaranteed as long as you stick with the recovery. And that is that your blood vessels must heal. Okay? Now, anyone who's vaguely familiar with this channel will know that I go on about this quite a lot, but I'll just recap it here. Basically, what they have found, the medical researchers, is that in POTS patients, the ability to constrict your blood vessels upon standing is impaired. And what happens in POTS patients when they stand up is that their blood vessels do not constrict fully. So they don't squeeze as much as they should. They remain open or partially open, which means that the heart, when you stand up, has to beat even faster because it's got an increased overall area of blood to cover. The veins haven't squeezed, they've remained open. So therefore there's more of an overall area that the heart must cover. So this is another reason why the heart beats faster in the POTS patient upon standing. But that in and of itself cannot be switched off or miraculously changed through brain rewiring. Rather, that takes time to heal. It takes biological time. It takes months. No one's done any studies on how long it takes for blood vessels to heal in these circumstances. But they do heal because these blood vessels are situated in soft muscle. And soft muscle is, of all the muscle types, the kind of muscle that is replaced most speedily by the body under normal circumstances. So if I look back to my own case, I would hazard a guess that my blood vessels were healed up after 4 or 5 months after I started the brain rewiring. And certainly when one looks at recovery stories of people from POTS, using the DNRS program, there is no reason to think, given that they're sort of normal heart rates at the end of it, there's no reason to think that this healing up won't occur. Yes, so the second factor is the blood vessels healing up. The blood vessels, I won't go into it here because it would take too long, but if you look at my other videos, I do talk about how the flight or fight crisis in the brain leads, I believe, to the blood vessels malfunctioning. So the blood vessels then patch up. Now when they patch up, as it were, which may take however many months, and depending on the state of the impairment, it may take longer, right? Because some people's blood vessel dysfunction in POTS is more extreme than others, and that depends on a range of factors. So it may take 4 months, it may take 6 months, it may take 8 months, whatever. But the main thing is that they will heal, and you can help that along by eating an excellent diet. But when that happens, then when you stand up, your blood vessels will be constricting properly when you stand up, and so your heart rate will reduce again. This is the second factor. So maybe now we're talking about it's increasing by 25 beats per minute in our imaginary example from earlier, which of course is under POTS criterion, although that's all supposition. Okay, but I'm just using it as an example. So suddenly, you have another strain taken off the heart with this second factor, which takes time. Okay, so don't be discouraged if you are starting on your POTS rewiring journey and you're feeling, oh well, my heart rate is still going up quite a lot when I stand up. It couldn't be otherwise. It could not be otherwise. These blood vessels take time to heal. and you need to have your autonomic nervous system back into normal rest and digest mode so that the body can send the nutrients to the blood vessels which are impaired to heal them up. It takes time. It does not happen overnight. So that's the second factor. And the third factor, very important, is cardiovascular reconditioning. I downplay this deliberately in terms of the theory of why I believe POTS occurs, because I believe that the idea that POTS is caused by cardiovascular deconditioning to be quite insidious and detrimental to everyone. But there is nevertheless a massive factor of deconditioning as a secondary factor. People become deconditioned as a result of having POTS. You become deconditioned if you have a week in bed, let alone 4 years. Okay, so this is a big factor, and you cannot have the normal heart rate increase from supine to standing, which is 10 to 20 beats per minute, and it stays at 10 to 20 beats per minute when you stand up, until you are cardiovascularly reconditioned as well. And that takes time. Right, that takes time. But you can count on a kind of 10 to 20 beats of your supine to standing differential is actually as a result of cardiovascular deconditioning, at least 10. So you can expect that when you have got out of the state of hardwired crisis, when your net proteins with the blood vessel dysfunction, when that's healed up, and then you're in a position to take proper exercise again, and I mean proper exercise, that you will then get that last part where you will be able to get your heart rate down to completely normal ranges of 10 to 20 beat increase. But it can't fully get down to that until you're cardiovascularly reconditioned. So it's all these three factors together. The switching off the automatic adrenaline release will lead to immediate reduction in heart rate. Keeping up the discipline of the brain rewiring practices and allowing enough time to pass should lead to the healing of the blood vessels, which will lead the heart rate to come down again. And then finally, the cardiovascular reconditioning, the last piece of the puzzle, not the first, the last piece of the puzzle will then allow you to fully build up your cardiovascular strength and have normal supine to standing heart rate scores. But it is those three factors. So I want to say this because it's very important that if you are in the situation that you're noticing your heart rate is coming down, but it hasn't come down enough yet, you're anxious, why hasn't it come down more? I've been doing this for 3 months. Maybe you might think to yourself, for example. Don't worry, you're on course. You're on course. You've got the first factor. Well, the other two factors take time, but you'll get there. You've already gone this far, but you'll get there. So that's what I want to say about that. I hope that's helpful for anyone who's currently rewiring and worrying or wondering about how the sort of heart rate is meant to come down and why. And obviously this is all supposition in terms of the theory I'm putting forward, which is an hypothesis. It's not gospel, but it's why I believe it's the three factors I believe are responsible for heart rate reduction in recovery from POTS.